Hi, welcome to CBT Skills Made Easier, and we're going to look today at using the skill of CBT from the inside to overcome fears of aspects of the course, particularly role plays and presenting tapes. So that's an understandable fear. I still get it. I've been around for a while. Whenever I ask a question and make a comment, I can feel my heart thumping, but I do push myself to do it. But it's even more difficult when you're starting off a course like this. So try and decide if it is a bit of a difficulty for you and do a CBT from the inside. So think about what your triggers are. Typical triggers would be having to present a tape or having to do a role play, or sometimes even participating in the class or speaking up in class. Try and think what your anxious thoughts are. They'll be idiosyncratic to yourself, but might be, I'll make a fool of myself in front of the lecturers and my classmates. I don't know what I'm doing. I'm an imposter. I'll be incompetent. And other thoughts along those lines. And that's going to make you predominantly anxious. It's often worth thinking about the sort of process as well, then, where your attention goes when you're anxious. So we know attention tends to go on your physical sensations you have, or on the threat of the presentation or the doing the role play or whatever. Think about thinking errors that might be in your mind, such as mind reading or catastrophizing. Think about if you've got any images about that situation that you have to do or expected to do, or that links back to any memories, that can be helpful. Something might happen at school. And then think about the avoidance behaviours and think about avoidance or reassurance seeking behaviours or safety behaviours around these triggers. So avoidance behaviours, for example, with tapes might be not bringing tapes, only bringing tapes of good patients, only playing a good section, only asking questions about formulation, so it won't lead into having to do any sort of role play and so on. So think about what your subtle avoidance behaviours, or asking a question. It might just be a reassurance type question, rather than a question that's going to, develop you. And then think how you can work on challenging those negative thoughts. From my perspective, the lecturers and your fellow classmates will be kind and understanding and will not want to allow you to make a fool of yourself in any way. And if something's not quite right, we'll be able to tell you that in a supportive way and give you another chance to practice it and hopefully do it a bit better. So challenge your thoughts. Think about making sure you're understanding that process that's happening for you at the time. Then obviously the key thing to do is the behavioural experiments, the exposure. So you're wanting to find a way to, from an early stage, I would suggest is better to push yourself into starting to show excerpts of tapes, asking to do role plays and participating in them fully. And that's going to be the best thing to do. Of course, it's tempting at the time, if you're anxious about that, to just give into avoidance. But there's cost to avoidance as well, because you might get away with it to some extent, but you won't learn so much. You may even encounter a more negative response if you don't participate in the class from some people than if you are trying to participate. So CBT from the inside is great. It can help you deal with any anxieties that you've got in the class, and it can give you a real feel for what it's like to be a patient and thereby increase your empathy. So I hope that's helpful. So au revoir.